What's going on, everyone? Data Report here for datareport.info with the pandemic update for Friday, March 3rd, 2023. First, we'll start off with a little bit of good news. I have not found any new COVID positives or any new COVID outbreaks in the last 24 hours since our previous video. However, I do have some news on long COVID. I have about 3 long COVID stories. First off, study links long COVID with lower oxygen levels in the brain. And if we look at this study, it says here, let's look at the story at a glance. The CDC estimates 1 in 5 people who had a COVID-19 infection may have long COVID or symptoms that persist after infection has passed. A new study suggests that people with long COVID have lower brain oxygen levels. The results also suggest that people with long COVID may suffer from continuative dysfunction. And that makes a lot of sense. If the oxygen level in your brain is lower, you're not going to function properly, you're not going to be able to think properly, and that can lead to a lot of problems, including dysfunction, and something else we're going to talk about in a moment. And then we come over here to this. Long COVID is associated with significantly increased risk of death, heart, and lung problems, study finds. Look at this. The study examined insurance claims data for 13,435 adults with long COVID and 26,870 without COVID-19 during a 12-month follow-up period. Accounting factors present prior to infection, the long COVID group experienced increased mortality with 2.8% of individuals with long COVID dying compared to 1.2% of those without long COVID. And finally, we have this. This is something that @MeetJess tweeted about on Twitter. If you haven't followed this account, follow it. It's a great follow on Twitter, and we have done spaces together before. But anywho, 3 in 5 long COVID patients have organ damage a year after infection, finds study. We identified organ damage in 59% of participants a year after their initial symptoms. And this is something I have mentioned before on the channel. This is something that people speak about often on Twitter. And it's something that really does not get enough attention because a lot of people have, a lingering side effect or a lingering something damaged after having a COVID infection, and they don't link it back to their initial COVID infection. Like, for example, the brain damage, the oxygen issue. When you're not getting enough oxygen in the brain, it can also help accelerate memory loss. And I personally know some people who have memory loss issues post-COVID, and one of them has now developed dementia and Alzheimer's. It's not good. It's not a good thing at all. And many people are just not putting the link between COVID and new issues that they're starting to have now. Many of them are saying, oh, it can't be caused by COVID. COVID was just a mild flu, blah, 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 mild cold. Can't be this or that. Wrong. It can be COVID, and it is causing these organ problems like heart damage, lung damage. I personally have nodules on my lungs. Didn't have that before COVID. Still working to find out what that's all about. But yeah. So yes, this is a big issue. Then we come over here to this, and we take a look at the wastewater. So let's get to the data side of things. As you can see here on today's update for wastewater, and there was an update here. It's pretty clear because there's some changes. Taking a look here first in Maine, some of the wastewater sites have dropped, but there are still moderate levels ongoing, but not as high as we were seeing the last few days. Vermont, there's some moderate levels. And then you come down to Pennsylvania, it's generally low with a couple moderate areas and one high area. Ohio, there's less high areas, still a ton of orange moderate areas. A few more moderate areas around Chicago now than we saw in the last couple days. And Wisconsin is a general mix of moderate, high, and low. Nebraska, it almost looks to me like there are more high areas in Nebraska now, and that's not good. Utah, less high areas, still a ton of moderate areas. And we have a few more moderate areas popping up in California. Here's one that's not too far from Santa Barbara, 69,290. in that waste treatment facility, and that's quite a high amount. Here's Kern County. This is dropping, but it is coming up as moderate, 279,000 in that facility. And we'll just do one more here in California. How about down here near San Diego? 2.2 million. It's coming up as moderate, but right now it does appear to be flat. All right, we did get an update today on the transmission and the variant proportion. First, transmission. High transmission has dropped a little bit. 1,574 counties have high transmission of COVID. Substantial is at 874 counties. Moderate is at 604 counties. Low is at 170 counties. Excuse me. XBB.1.5 makes up 89.6% of the cases. BQ.1.1 makes up 6.7% of the cases, and BQ.1 makes up 1.6% of the cases. New York State, 1,555 new cases in the last 24 hours. The test positivity of 3.4% is higher than the 7-day average of 3.1%. Taking a look at the hospitalizations in New York State, 1,696 people hospitalized, 187 people are in the ICU. All right, Walgreens. Here in Maine, some good news. Remember the positivity was rising? And it's still showing up red here, but look at the chart. We're going to zoom in the chart. It's showing signs that that has peaked and is now starting to drop. And remember, it was over 40% yesterday. Today it's at 37.7%. Prior week was 31.9%. That's a difference of 5.8%. New Hampshire has also peaked at 35% positivity this week, 16.2% last week. That's still a difference of 18.8%. Then we come down here to Connecticut. Connecticut has started to rise. The current week is 31.9%. The prior week is 22.4%. That's a difference of up 9.6%. Total number of tests in Connecticut are 144. Prior week was 143. And real quick, the national level, which I forgot to do, is at 31.1%. The prior week was at 32.1%. That's down 1%. Testing is 21,242. Prior week was 22,768. New York State, you have to zoom in to see this one closely. New York State's at 32.2% this week. Prior week was 38.6%. That's down 6.4%, but look at the chart. It has bottomed, and there may be some early evidence that it might be starting to rise again. We'll see. 909 total tests this week, 969 last week. New Jersey, we have been watching rise a little bit, but it's starting to flatten out now. So I think it has peaked for the time being. 26.6% this week, 24.8% last week. That's a difference of up 1.8%, and testing is down. 740 tests this week, 875 last week. West Virginia, we've been watching this rise, and it looks to me like the rise is becoming more significant. West Virginia today is at 40% positivity. Prior week was 28.1%. That is up by 11.9%. 70 total tests this week, 64 last week. Again, that's not a lot of tests, but you know what? That doesn't matter. They are rising. That's a legitimate rise. Current week for Indiana, 38.5% this week, 33.5% last week. That is up 5.1%, and you can see it here on the chart. It is legitimately rising. Kentucky, 32.6% this week. Prior week, 28.2%, up 4.4%. That's a difference in testing, though, is down. 288 this week, 301 last week. How about Nebraska? Believe it or not, Nebraska is saying down, but look here real closely. Nebraska is starting to rise on the chart. 29.4% this week, 39.7% last week, which is down 10.2%, but they have bottomed out, and I think they are starting to rise again. There's an increase in testing this week as well. 163 tests this week, 121 last week, and if you remember, on wastewater, we saw Nebraska was at moderate to high. One last one. Let's take a look at New Mexico. The current week is 34.7%. The prior week is 28%. That's a difference of upwards 6.7%. And testing is up with 193 this week, 189 last week. Taking a look at current hospitalizations nationally, 26,194 people are in the hospital. ICUs nationally, 3,224 people are in the ICU. Current weeks for deaths are at 2,252 deaths so far. The previous week is 2,471 deaths. So deaths are slightly down now, week over week, after being higher than last week for the first part of this week. So that's some good news. Taking a look at some international data. You will see here, Germany is up 9% on cases, which is that's somewhat better than what it has been. So they're not rising as much. Maybe they are starting to peak on this wave. Deaths, however, continue to rise, up 13%. Taiwan is down 21% on cases, down 23% on deaths. Russia is down 16% on cases, down 4% on deaths. Brazil is up 51% on cases, down 52% on deaths. Austria is up 15% on cases and up 8% on deaths. Italy is now down 9% on cases and 7% on deaths. France is down 2% on cases and down 2% on deaths. Australia is now up 9% on cases, down 21% on deaths. And Poland, check this out, up 18% on cases, now up 80% on deaths. 74 deaths this week, 41 last. Chile is up 27% on cases and down 22% on deaths. And we'll end on Belgium. Belgium is up 8% on cases and also up 7% on deaths. Alrighty, that does it for today's pandemic update video. We will have another pandemic update video on my channel tomorrow. If you find my content to be informative or helpful to you, hit the like and subscribe button down below. And until next time, stay safe, everyone.